Welcome back. An ambitious effort to break the cycle of violence in Atlanta has become a lifeline for hundreds. It's been more than 2 years since Grady Hospital launched a program called Ivy to combat gun violence. And tonight, Aisha Howard takes a closer look at the results it's already producing.
Every day, I would see patients come in through our trauma bays injured by violence, and I knew that I wanted to be a part of the solution. I wanted to figure out what was bringing them here in the first place and prevent them from coming back.
For trauma surgeon Dr. Randy Smith, treating wounds wasn't enough. She wanted to stop the bleeding at its source.
In lots of places, people are just patched up and sent right back out into the neighborhoods and the circumstances that led to injuries in the first place.
It's what led her to help launch the Interrupting Violence in Youth and Young Adults program with Grady Health System in January 2023. It provides critical support for gun violence victims ages 14 to 34. When a victim of violence arrives at the hospital, Ivy staff not only offer medical support, but serve as a source of trust, guidance, and resources.
We are understanding the root causes. We're focused on addressing those social drivers of health that impact how patients do when they leave the hospital.
In just over 2 years, Ivy worked with more than 650 participants and their families, providing food, housing assistance, and mental health support. And the program is getting results.
We have really interrupted that cycle of violence that I spoke about, where less than 3% of our participants have come back into the hospital with a violent injury.
Violence intervention specialists like Nkosi Cave are the pulse of the program. He says he understands the importance of meeting patients where they are.
When we meet people at the bedside, we kind of see a reflection of ourselves and our communities and our patients, right? So a lot of times when we're meeting people, we're seeing people that we might have known in the community.
For Nkosi, this work is deeply personal. Growing up in Atlanta, he says he always knew he wanted to serve his community. Now he gets to put his master's degree in public health to work in a meaningful way.
We come from the same communities as a lot of these people, so we talk the same language, right? So a lot of times it's really just about getting to know that person and really sitting down and listening. A lot of times when people come in with gunshot wounds, they're stereotyped, but for us, these are just everyday people who are in our community and people who actually need help. And these are actually the voiceless, the people who aren't able to really express their concerns.
For this team, they say it's not just hard work, it's heart work. Aisha Howard, 11 Alive News.